Working at Sarasota Plastic Surgery, we see so many patients come in for so many procedures, and we know that each time a patient comes in, it's a huge, huge deal for them. It's maybe their only time doing this. It is something that people need to think about. Collect their information. They come for the consultation with Dr. Graham, who of course is very reassuring and just makes you feel comfortable. The next step is generally to come back for a pre-op visit. At that point, we go over the medical history, the prescriptions, the pre-op care and the post-op care, and we also do the pre-op pictures. That's often a very scary thing for patients. It's all of a sudden they think this is really happening, and we're in a room with the door closed, the light, maybe they're undressed, or maybe they're just having that mugshot type of picture that is overwhelming, and a lot of times that's when they'll say, I'm really scared. Or I'll ask them, are you nervous, are you excited? And you know, it's normal to be a little nervous, it's surgery. And then they'll say, have you had anything done? Who would you have do your surgery if you were? And they need reassurance. And of course, all of our doctors are wonderful, and they all have different personalities. And I'm really confident to tell them that they're in good hands with any of the doctors. I've known Dr. Graham for 25 years, and he's my doctor, and of course I think he's absolutely wonderful. But that time in that room is sometimes where people really maybe ask us things that maybe they don't have friends that have had procedures done. They don't have the person to talk to, and I think it's a real close bond. You know, maybe somewhere between a hairdresser and your bartender or whatever, that you know you want to talk about things, and we take the time. We really try to always have the time to talk to patients about those kinds of things. The other big moment is the one-day post-op visit. You know, maybe they've had facial surgery, they've got the big turban dressing, you know, they're a little drowsy, and again they come in and we have them in a private room that they come in the back door, and oftentimes that's when they say, what have I done? I don't have anybody to blame, this was my own decision. And we say, 2 weeks from now you'll be saying, I'm so glad I had it done, I should have done it sooner. And there are moments, and we prepare them for it, that usually maybe 3 days into it, I think you've slept, you've kind of recovered, you know, from those first days when you're really, really tired. Then you're feeling pretty good, and you're like a little cabin fever or something stuck inside, and people can get a little depressed. We warn them about it, we tell them we're here for you, call us up, we can help you get through that. And it's not just come in for surgery and go, you know, see you in a week. We're here for them, and there are 4 of us, and we've got our phone, voicemail, and we can take the time to talk people through some of that.